So in terms of mobilization and all that, I would say that for cesarean section, it's a little bit slower compared to vaginal delivery. But there are also some pros of vaginal cesarean section now, because with vaginal delivery, right, because the baby comes through from below, there can be a lot more damage to the pelvic floor. So you find that control of the bladder, the anus is poorer. So some people have leakage, problems, or prolapse of the vagina. Prolapse means that the vagina tends to sag, especially as you get older, it sags more and more. And you may also have this pubis symphysis separation, where the pubic bone, usually joined here, separates a little bit wider and can be quite painful. It's very common in the last trimester. You find that when you turn in bed or you get up or you squat, there's this severe pain right at the bottom in the middle. That's pubic symphysis pain. Okay, and if you have a vaginal delivery, especially if the baby is big, it can worsen that pain. But most of us would recover, with time lah. So with cesarean section, you do avoid more damage here, but because it's a surgery, there can be injury to the neighboring organs like the bladder or the intestines, although the likelihood is very low. So it's usually more the recovery period and of course the impact on the subsequent pregnancy, because the likelihood of you needing a Caesar again is a bit higher, because the risk of a vaginal delivery after Caesar tends to be slightly higher due to scar rupture. Placenta accreta is quite a rare occurrence, but it's a horrible one to happen. Placenta accreta only happens in the next pregnancy. So it's when the placenta, the placenta is supposed to come out after you deliver, right? But in accreta, the placenta is very embedded into the wall, the muscle. And sometimes when it can even invade through the whole wall of the womb and even penetrate to the bladder if it's in front. So when you deliver the baby, the placenta cannot come out because it's stuck there, and then maybe you need to even remove the whole womb. But it's a rare occurrence. So if we Caesar, the fear is that if your placenta plants on where the scar is, there might be a higher chance of this accreta thing happening because of the scar. Okay. So over the next few days, whilst you're in the hospital, try and relax as much as possible, because you're going to get quite a lot of help with the nurses being around and all. But of course, you need to pick up as much tips as you can with regards to breastfeeding, okay? Because the nurses can be there to guide you. Once you're home, you're kind of left on your own. And breastfeeding can be quite challenging. And later on, of course, our LC would go through with you again what are the tips and what are the help resources that you can go for. Get as much help as you can. Maybe if you've got a helper, if you've got your mother or mother-in-law to give you any help, don't try to do everything yourself, okay? You're not a superwoman. Try to rest, because you have gone through a major event, childbirth. Your body needs as much time to recover. And with breastfeeding itself, it can be quite tiring. So concentrate on breastfeeding, resting, and the rest of other things. If you can palm up to other people, do so, okay?